Welcome back. You're watching Channel 1 News Hour. The Ministry of Health is not clear on when the country will receive its first doses of the Covid-19 vaccines. Earlier this month, the ministry had promised that the country had ordered 24 million doses of AstraZeneca vaccine that were to arrive in the country by the second week of February, but has now shifted the arrival date to April after receiving funding from the World Bank.
Kenya could wait longer for the arrival of the Covid-19 vaccine, with the Ministry of Health now ruling out its earlier promise of the jab arriving in the country in the second week of February. The ministry now saying the earliest possible the vaccine will arrive in the country will be April, after receiving funding by the World Bank and assurance from the African Union that has ordered 270 million doses under the African Vaccine Acquisition Task Team from Pfizer, Johnson & Johnson and AstraZeneca.
We are looking at being ready as a country by around April. But again, leveraging on our existing infrastructure that the minister has just talked about, it is also possible that we may have the vaccine even sooner in the country. But we are well positioned right now, and we should all be comfortable to know that the vaccine will be in Kenya very soon.
The ministry is, however, lauding stringent measures put in place to curb the spread of the virus in the country, including the 9 p.m. to 4 a.m. curfew that it says has played a major role in minimizing the infectious rate in the country. Health Cabinet Secretary Mutahi Kagwe, who was at Kenya Medical Research Institute, KEMRI, revealed that the government was not going to ease the measures despite the positivity rate being below 5%.
We intend to keep the current measures that are there. We intend to keep on a very high level of surveillance. We also want to embark on serosurveillance to find out, and this institution is going to be key to the way we want to go forward, particularly to test our people and find out how many of us would probably have had COVID and not known about it, and therefore we can tell what levels of herd immunity we have developed.
So far, according to the ministry, only one positive case has been reported in schools 3 weeks after learning resumed.
As you know, we reported that we had a case which had in one of the schools in Nairobi. We isolated the child and tested the entire school, and I'm glad to report that everybody was negative.
During the past 24 hours, the country recorded 136 new COVID-19 cases from 3,787 samples tested. The new cases takes the cumulative positive cases in the country to 99,444.
Today, 136 people have tested positive to the disease out of a sample size of 3,787. That means that our positivity rate is still below 5%. This is a good sign, and we are hoping and praying that this is something that is going to continue.
Kagwe said Nairobi continues to lead in the infection rate with 67 new cases, Homa Bay and Mombasa 11 cases each, Meru 10, Kisumu 8, Kiambu 5, Kilifi 4, Nakuru, Kajiado and Siaya 3 cases each. Over the same period, the country lost 2 patients and recorded 176 recoveries, 162 from the home-based isolation care, while 14 are from various health facilities. Suleiman Yeri, Channel 1 News.